Let's chat about interstitial cystitis for a second because it's one of those conditions that's really frustrating and really a pain to live with, literally. But it's a condition where people have bladder issues. Specifically, they have some type of pain, usually either with peeing, with bladder filling, or some type of pain in the bladder area or the pelvic area. It often is also included with urinary frequency, urinary urgency, so sensations like you really have to go when you don't have that much in your bladder, going a lot, etc. There's a couple of really frustrating things about it. Number one, it's a diagnosis of exclusion. That means that there is no one specific test, lab, etc. that is going to tell you you have interstitial cystitis. They basically just have to make sure you don't have a UTI, you don't have kidney stones, you don't have pelvic inflammatory disease or an STD or anything like that that could be contributing to your symptoms. And when they can't find anything else and you still have those symptoms for a certain amount of time, that's when they give you the diagnosis of interstitial cystitis. So it's frustrating to get that diagnosis because it means they've had to kind of rule everything else out. Another thing that makes it tricky is that there's not usually one thing that's causing it. It's kind of, there's a lot of different contributing factors. It itself can contribute to a lot of different things. It often runs in the same circles as endometriosis, vestibulodynia, vulvodynia, a lot of other pelvic pain conditions. They overlap with interstitial cystitis and they all kind of feed off of each other. So it's not one specific issue necessarily. It's kind of a lot of different things going on. Also makes it a little tricky to treat because there's usually not one specific medication or one specific treatment that is going to work well for everybody with this condition. There's a lot of different combinations of treatments, things to try, etc., before you kind of find things that work for each individual person. So it can be a little bit complicated to try to find what works for you.